Hi guys, our video for the lip filler that we posted on our YouTube channel have so many DMs, people asking us variety of questions regarding fillers in general and different areas, to be particular, under eyes, cheeks, jawline contouring, chin augmentation, name it. So we decided to start answering to the questions, and today's topic will be under eye fillers. Here is Jessica with us. She will just ask me questions that we got through the DMs, and I'll be more than happy to answer to you. Let's start.
Okay, so who is the perfect candidate for under eye filler?
That's a good question. The perfect candidate for under eye filler is anyone who has like the hollowness, volume loss in the tear trough area, and basically kind of has their tear troughs disconnected from their mid-face or the cheek area. So that will be the best candidate. So
okay, great. And what kind of pain level or what kind of downtime is there involved?
So surprisingly, there is no pain. I will say 0 to 10, probably 2 or 3 max for people who has very like low pain tolerance. And downtime, of course, if by accident we will just hit the blood vessel, they can be a bruise.
Okay.
Very rarely we're just having black and blue, because now, especially when we start using the IQ vein device that like visualize the veins, we diminishing the chance of bruising a lot.
Oh, that's great. How many how many syringes would one use?
It really depends patient to patient. Everyone is different, and you know, surprisingly, sometimes you have to treat other area like a cheek to improve the tear trough area in general, and patient will end up using 0 syringes in their tear troughs, but placing 1 or 2 syringes of fillers, let's say voluma, in their mid-face, will just improve their area of concern.
Oh wow, okay. How long does a patient expect their results to last?
I have to tell you, because we're using for the tear trough area hyaluronic acid fillers, such as Restylane, Juvederm, Velour. It really depends which filler we will be using. They will expect to last year plus, even though I have to tell 6 months, 7 months, a year, depends what's the duration of the product on the insert. But in the real life, it lasts much longer.
Okay, and what about results? Are they immediate?
Results are immediate, but I like to undercorrect. I don't like to overcorrect or 100% correction. And it's better for the patient to come and add as needed in a month or 2 months period, rather like to overcorrect and then make to remove the filler.
Okay, and how will you decide which filler suits which patient? Is it different for everyone?
Yes, it's different it's not really different. Again, the filler of the choice will be hyaluronic acid fillers, but it will be different. People with the really light skin, that you can see a lot of underlying capillaries, I will use very light filler like Restylane Silk or regular Restylane or Lobella. People has a little bit thicker skin, or just ethnically their skin has more pigment, I will go for a little bit thicker filler such as Juvederm or Velour.
What about a person with dark circles?
You know, sometimes when people coming with the dark circles, it's not necessary that it's due to the lack of volume in the area. It might be a case of allergy. People with the severe allergy, they have a lot of darkness in the area, and by placing fillers, you're not doing much to them, but taking their money, kind of, which is not really right. Yeah. So in the cases like that, I will refer them to the physicians who specialize in allergy treatments to figure out what's the reason of their allergies and treat underlying conditions. Or people coming like, I anticipate your next question. So people coming with the very fine lines and wrinkles, right?
Yes.
You hear that question a lot and ask you, oh, can I put filler? And they even pulling their skin, like thinking if you will put filler, it will. Sometimes patients coming with the fine lines, wrinkles, very super paper thin skin, and thinking that fillers it's the best idea for them. Not really, because by putting filler here and just plumping the area, you're not doing much to the area except like having this swollen look.
Right.
So you want to place filler under the skin, which is healthy, thick, and have a nice resistance. That way you will have a good results that will last you very long time. In situation where we're just experiencing very thin skin, I will advise to start with the skin firming procedures. PRP with microneedling, Endymet, 3D, BTL. Most advanced is like for that area, I will say probably oil therapy.
Right.
I will advise patients to do the series of these procedures, get thicker, healthier skin, and only then just to reevaluate the area. Like majority of time, we do not need to put filler because we improve the area, the health of the skin, and we resolve the problem.
Yeah. Okay, thanks for answering all of our questions, and you guys feel free to follow us on Instagram and DM us anything that you guys want to know about, and we'll film it and put it up for you.
Bye guys.
Bye.